Hi, my name is Rachel McCarthy. I'm with the Institute of Massage and Sports Therapy. So today we're going to look at the treatment of an acute ankle injury, be it an ankle sprain, for example, where they've damaged or injured some of the ligaments here on the outside of the ankle. So this is recent, they've just come off the pitch, for example. We've all done our usual rest it, ice it, compress it and elevate it. And we all know the advantages of using an ice pack for killing pain, helping those sensory nerves to calm down, for reducing the blood flow to the area, reducing bleeding. So we all know the benefits of ice, and I would still continue to use ice for those benefits. The negative effect of using ice, however, is that it slows down lymphatic drainage, and that's going to be a problem. We want to boost the lymphatic drainage to this area because that's what brings in the fibroblasts and the immune system and starts to actually begin the healing process. So the sooner we can stimulate the lymphatic drainage, the faster this injury is going to recover. So I would still continue to use my ice, but I would also then apply kinesiology tape because that's going to counteract the negative effect of ice and boost the lymphatic drainage. So I've cut the tape, as you can see, into 4 little strips with a solid piece here at the top. So that's going to be called a fan shape. And this is a very specific taping for kinesiology tape, just for acute injuries. So I remove the strip. It's going to be my anchor. And my anchor is going to be above the site of the injury. That's very, very important because that's going to determine which direction I'm boosting the flow of lymphatic fluids. So I want to boost the flow up the leg so that it'll drain and take away the waste products that have seeped out into the area. So you do it strip by strip, follow down along. I want to get 100% stretch, back off to 50, back off to about 20. So 20% stretch on the tape for an acute injury. Go again. 100%, 20, 50, 25. So it's a nice slight stretch on the tape, that's all. That's enough just to lift the tissues and make space underneath for the lymphatic fluids to drain. And one last one, right down over where they're going to have the swelling. So you cover the area that you can see the fluid or the bruising starting to form. And I'd usually do a second one, just kind of going across in a slightly different direction to lift the tissues in different directions to create more space underneath for the fluids to move. So again, a bit fiddly, 20% stretch, right down over the point of injury, right down over where you can see the fluid starting to build up. Slight stretch only. So this is boosting lymphatic drainage. It'll also help kill pain. It'll help clear up the bruising an awful lot faster. So it's counteracting the negative effects of ice. So my treatment for an acute injury will now change. I will rest it and ice it, maybe compress it, we'll see. I prefer to use this rather than compression, and I continue to elevate it. But by using this then, I'm boosting the lymphatic drainage, and that should get this person through the acute phase a lot faster and get them back to their chosen sport a lot faster. So lymphatic drainage techniques with kinesiology tape. Thanks for watching our video today. For more information about who we are and what we do, check out our website www.imst.ie. Thank you.